My name's Sierra. I'm going to be conducting a physical exam on you today. Is that okay?
Yes, ma'am.
Okay. Do you have any disabilities I need to know about that affect how you lay down or walk?
I have neck and back problems. I have a lot of herniated discs.
Okay. And I'll try to be careful.
Okay.
Do you have any problems with me touching you?
No, ma'am.
Okay. Then I'm going to start out by palpating your scalp and checking for lesions. Okay. I know it's winter time and some people get dry scalp. Do you have that problem?
Yeah.
I don't see any lesions on your scalp.
That's good.
Does this hurt?
No, ma'am.
Okay, I didn't feel any lumps either, so that's good. Next, I'm going to check your neck, the range of motion, which is just how easy it is for you to move your neck. You can look that way, look that way, you can look up and down. Do you have any problems doing that?
I have trouble turning my neck to the left and looking down.
Okay. All right. Can you smile for me? Okay. Now the next thing I'm going to do is I'm going to check your neck for several different things. I'm going to palpate, which is I'm just going to be pressing. You might feel a little pressure, but first I'm going to look for your cervical and your lymph nodes. Okay. Now normally these aren't, you can't palpate these, but have you been sick lately?
No, ma'am.
And I don't feel them, so that's good. Any of this hurt?
No, ma'am.
Next I'm going to check your temporomandibular joint, which is just your jaw. Okay. Open your mouth. Now close. Does that cause you any pain?
No, ma'am.
Okay. Next, I'm going to check for your thyroid, which is just a gland in your neck. It's right here in the front, but this might feel a little funny. Okay. Now I'm going to come from behind you because there's two ways to palpate your thyroid.
Okay.
Okay, can you swallow? I didn't feel your thyroid, which is good. Normally you can't feel it. And the last thing is your trachea, which is just your windpipe. Okay. And that's straight in the middle like it should be, so that's good. Okay. This is called a visual acuity chart. So next we're going to check your eyes. And I want you to take your glasses off and then hold it about like that and cover one eye.
Okay.
And then the numbers, read me the lowest line you can.
4, 2, 8, 3, 6, 5.
Okay, now the other eye.
6, 3, 9, 2, 5.
Okay, is your glasses, do they have different prescriptions in each lens?
Yes, ma'am.
Okay, because you read different lines, which indicates your vision is different in each eye.
Yeah, I've had problems with my vision in the past.
Okay, next I have to look into your eyes with this. It's called an ophthalmoscope.
Big one.
It's going to be a bright light in your eyes. Will that bother you any?
No, ma'am.
Okay, I'm going to have to cut the lights out real quick. Okay, just look right into the light. Okay, you have red reflex, which is just something that should be there on your cornea, so that's good, and you have it in both eyes. Now just look straight ahead for me. And this is just checking to see if your pupils react to light, which yours are, and that's normal. Okay. Next, I have to check your extraocular movement. That's just checking to make sure all the muscles in your eyes are working right. And follow my finger with your eyes, okay? Okay, everything seems fine with your eyes. Let's see. All right, now I'm going to check your ears. Do you have any problems with hearing?
I have They said hearing loss in both ears of 20%.
Okay. Well, I'm gonna use this again to look into your ears this time, okay?
Okay.
I'm gonna have to pull some on this part of your outer ear, okay?
Yes, that's right.
Okay. Let's check the other ear. You don't have any sores on the outside of that one ear. Some people can get sores on their ear and not even know it.
And then my left ear bleeds a lot.
Okay, well, your eardrums look normal.
That's good.
Okay, now I have to do something called a whispered voice test, which is going to check how well you hear in each ear.
Okay.
I'm going to stand a little bit behind you and whisper something. And if you can hear it, repeat after me.
Okay.
Did you hear anything?
No, ma'am.
Okay. Now we'll try this here. Did you hear anything?
No, ma'am.
Okay. Have you been to a hearing doctor here lately?
No, ma'am.
But they have told you you've had hearing loss before?
Yes, ma'am.
Okay. All right. Your nose. You have any sinus problems?
Not since I had all my teeth pulled.
Okay. Well, I'm going to palpate your face. There's 2 sets of sinuses you can feel. Okay? The first one I'm going to check here, which is your maxillary sinuses. Does this hurt or anything?
No, ma'am.
Okay, the next one's your frontal, which is just behind your eyebrows. So I'm going to press on your eyebrows a little bit. No pain?
No.
Okay. Now I'm going to have to look into your nose to check for nasal patency. Make sure your nares are open, your nostrils.
Oh,
Is that okay?
yes, ma'am.
I want you to lift your head up a little bit and kind of as far up as you can. You don't have to hurt yourself. If you want to, you can hold your nose up a little bit. Oops.
Tickles.
This is the last time you use this. These aren't the right fitting ones. It worked. Okay. Have you ever broken your nose?
I got punched in it a few times.
Okay, I need that one. Okay. Well, you don't have any problems with your nose. Can you do this and sniff in? Now out. Do the other. Okay.
This side always feels stuffed up, but
No real problems breathing?
no.
Okay. Now I'm going to have to look at your mouth. Just look inside to check your gums. Can you open up? Stick your tongue out. Okay. Now I can see your sinuses without the tongue blade, your sinuses, I meant your tonsils, which isn't abnormal. Some people you can see their tonsils without a tongue blade, so that's nothing to worry about. But you told me you had a sensitive gag reflex.
Very.
I won't make you elicit it again.
Thank you.
All right. Next is your heart. And I'm going to have to check your peripheral pulses, which is like your pulse at your wrist and your legs and all that. So I'll start with your wrist. Put your hand in one, please. This is called your radial pulse. It's your ulnar pulse. This one's harder to feel. Some people it's normal not to feel it at all. So yours, straighten line. This is the brachial. Let's see the other one. Next, I'm gonna check the carotid pulse, which is in the throat. Is that for normal? Any pain on you? Okay. Next, I'm gonna have to check your legs. The pulse is in.
Okay.
Is that okay?
Yes, ma'am.
Do you mind to roll your pants legs up?
Sure.
You'll have to expect. Is it okay if I take your shoes off?
Sure.
Everyone has a pulse behind their knee called the popliteal pulse. And the one here is your posterior tibial. And then your dorsalis pedis is on your foot. You have one in your upper thigh and your groin region called the femoral pulse as well. Okay, all your peripheral pulses are good, strong, so that's good. If one of your pulses is weak in your feet, you might have poor circulation, which means your feet will feel cold to the touch, but yours feel okay.
That's good.
Now I want to listen to you. Is that okay?
Yes, ma'am.
Okay. All right, there's several points I'm going to have to listen to on your heart. But just because I listen to one section for several minutes or what may seem like a long time doesn't mean something's wrong.
Oh, okay.
Okay. Just breathe normally for me. All right, I'm going to have to go under your shirt a little bit.
That's fine.
Now the most important pulse is the one right here. Okay. Okay, I'm going to go up under your shirt from this way to look for your apical pulse, okay? Which is the beat closest to your heart. Yours is pretty easy to find. It's a little harder on men sometimes. With women, it's right under the breast.
Men don't have hearts. Got cold spots.
Okay, now I'm going to listen to your neck, which I'll be listening to your carotid artery for something called a bruit, which is just like a whooshing sound of air, but hopefully you won't have any. Okay, hold your breath for me. Okay, breathe. Do you need a second before I do the other side?
No, I'm fine.
Okay, hold your breath. Okay. I heard a slight bruit on your right side. Do you have any heart problems?
I had a heart attack in 2009.
Okay. Alrighty. Now I'm just going to put my hands here on your chest and I just want you to say something, okay? About a sentence.
I have a very mean cat named Crixus.
Okay, that was just me seeing if your chest vibrates when you talk, which it should a little bit, and yours did normally. Okay. Now for your lungs, do you have any lung disorders like asthma, COPD?
I have asthma flares in the cold weather, and I have bronchitis.
Okay. You don't seem to be having any trouble breathing now. Is there any tightness in your chest or anything like that?
No.
Okay. I'm going to need you to stand up if you don't mind. Okay. Now I'm going to put my hands here, like at the bottom of your rib cage, and I'm just going to ask you to take a deep breath. Okay, you can sit back down. I was just making sure your chest, both sides expanded at the same time as you took a breath in. Okay? Alright, so now I'm going to listen to your lung sounds, and I'll have to listen on the front and the back.
Okay.
And again, just because I'm listening for what may seem like a long time doesn't mean anything's wrong.
Okay.
There's just a lot of sounds to try to figure out.
All right.
Okay, take a deep breath. Another deep breath. Another deep breath. Again. Can you lift your shirt up a little bit to your belly? Okay, another deep breath. Okay, you can put your shirt back. Alright, now I'm going to listen if you can lift up that arm a little bit on your side. Deep breath. Another deep breath. Okay, you can relax that arm. Now I'm going to listen to your lungs from your back. Deep breath. Again. Okay, I'm going to lift your shirt up a little bit from the back. Okay. Another deep breath. One more, just lift this arm up a little bit for me. Okay, deep breath. Okay. Did that make you feel short of breath or anything?
No.
Your lungs sound fine, which is good. Okay, do you know how to conduct a self-breast exam?
Yes, ma'am, I do.
When do you do it?
Every month. I usually do it in the shower around the middle of the month.
Is it on the same day every month?
I try to do it around the 15th.
Do you have a period anymore?
No, ma'am.
Okay. Do you know the technique of doing it?
Yes, I had two, actually I had fibroadenoma here and a cyst here, and they removed them.
How do you do your self-breast exams?
I raise my arm up, and I do it in a circular pattern like this, from the nipple out, all the way around the breast.
Okay, so there's also a way you do the circle and then you can go up and down.
Mm-hmm.
And then you need to be sure you check in a mirror, stand in front of a mirror as well to make sure that there's symmetry.
Uh-huh.
It's normal for one breast to be slightly different sized than the other, but there shouldn't be anything dramatic in terms of asymmetry, in terms of one being bigger or smaller than the other. Okay? Now, your abdomen. Have you had any abdominal surgeries in your past?
No, ma'am.
Okay. You mind if I check for scars on your abdomen?
Sure.
So you got a little scratch.
I got a hyper pit bull puppy.
He sounds cute.
He is. I'm training him to be a service dog.
Okay, since it hurts you to lay down for a long time, I'll go ahead and it'll be fine if you sit up. You can just sit up as straight as you can, okay? Now, the first thing I'm going to do when I'm assessing your abdomen is listen to your bowel sounds, okay?
I can lean back a little bit. If that's good for you.
However you're comfortable is fine with me. Okay, now lift your shirt up a little bit.
Ooh, it's cold.
I'm sorry. Okay, you can breathe normally. Your bowel sounds are normal, and that's good. Okay, the next thing I'm going to do is percuss, which is mainly just me putting your hand here and then me tapping my own.
Okay.
Okay. Tell me if this hurts you any. Okay?
No, ma'am. Mm-mm. No.
Okay.
All the problems I have are bone problems.
Do you have any problems out of your bowels?
I have occasional constipation, but that's medications. The doctor told me it would happen.
Okay. Now the next thing I'm going to do, I'm going to have to palpate, which might make you feel a little tender but shouldn't hurt.
Okay.
Okay, I'm going to scoot this back so it can see. And let me know if you feel any pain, okay?
Yes,
I'm going to start out with light palpation.
Okay.
No pain anywhere?
No, ma'am.
Any tenderness?
No, ma'am.
Okay, now I'm going to press a little bit harder, so let me know if it hurts.
Okay.
No pain?
No, ma'am.
Okay. Now, your appendix, do you still have it?
Oh, yes, I do.
Okay, I'm going to check for something called rebound tenderness,
Okay.
which I'm going to press really hard where your appendix is, and it shouldn't hurt.
Okay.
You ready?
Yes, ma'am.
No pain?
No, ma'am.
Good. Usually you only have pain when we do that, if your appendix is rupturing. So it's good that that's not hurting. Okay. You have any problems out of your kidneys?
No more than a normal person my age, getting up to go to the bathroom all the time.
But you do have back problems, don't you?
Yes, ma'am.
Well, I'm going to have to do something called checking for CVA tenderness.
Okay.
I'll be as easy as I can because it's going to be on your back.
Okay.
So you can feel it from your shirt.
Okay.
Can you lean forward for me?
Yes, ma'am.
Is this a sore area?
Not right there, ma'am.
Okay, I'm going to put my hand here, and then with my other hand, I'm going to strike my hand, okay?
Okay.
Let me know if it hurts. Did that hurt?
Yes.
Okay, I'm going to do this side, okay? I'm going to be as easy as I can. Do you think you could have a urinary tract infection, or is that your back pain?
That's my back pain. It's like it jarred my spine.
You have problems with your discs in your lower back, don't you?
Yes, ma'am.
Okay. Now for your musculoskeletal system, I'm going to check the range of motion in your arm, okay? Is it okay for me to check your arm, or would you rather me do a leg?
Might as well do them all.
I only have to do it just to be sure.
Whichever you prefer.
Okay. Is this your short arm?
Both of them. I've had rotator cuff repair on one, and the other one's been still.
Okay. I'm going to mainly be checking your hand, okay?
Okay.
So, turn your hand up like this. All right. Can you spread your fingers out? We'll make a fist. Okay, now open your hand back up. Place your palm down. And rotate it back up. Did any of that cause you pain?
No, ma'am.
Okay, then the range of motion in that arm is really good. And in that lower arm and in your hand. Okay, I'm gonna have to check you for scoliosis.
Okay.
Are you physically able to bend over at all?
I can, yes. It's not nice, but I can do it.
I'll only have to do it for a second, okay? If you don't mind, stand up for me. Now, you don't have to bend over just a little bit. Bend over when you're ready. Let's see, mainly I'm just put this up a little bit.
Okay.
Your spine feels pretty straight. Have you ever been told you had scoliosis?
Yes.
How long ago?
In my early 20s.
Was it mild or deep?
Mild, yes.
Your back looks a little swollen too. Okay. You can grab my hands. I'm just going to be checking your grip strength. Okay, so squeeze my hands. Pull me towards you. Okay, now I'm going to do the same thing for your lower legs. Try to lift your legs. Okay. Now I need to check your reflexes. This reflex.
Okay.
Alright, I'm going to start off with the main one, which people are familiar with, your knee. Alright, you ready?
Yes, ma'am.
Can I see your arm? Switch. Change my page. You can relax your arm for a second. Okay. Now this is me checking your biceps reflex, okay? Okay. Can you turn your hand up? Okay. It didn't work in that arm. Okay. Since that arm's bothering you, I won't do any more in this arm, okay?
All right.
Right, this is your tricep reflex. Put this part of your arm, let it hang loose.
If you need to, you can test this one.
It's fine. Okay, I'm gonna move this up so it can see me check your legs.
Okay.
Watch your glasses. Okay. Try the one in your knee again, okay? Mainly works better if your legs are dangling, but. Okay, you have one in your foot I'm gonna check too, okay? Will it hurt you to lift your leg up a little bit? This is called the Achilles.
I gotta go, gotta reach the sketch first. Yeah.
Alrighty. Okay. Now the next thing I'm going to do is see how well you can feel a light touch. So I'm going to want you to close your eyes, and then I'm going to use this cotton ball and touch different parts of your face. And I want you to tell me if you can feel it, okay?
Feel it. Feel it. Feel it. Feel it. Feel it.
Okay, your sense of light touch is accurate. You can open your eyes again, which means I don't have to see if you can feel sharp pain.
That's good.
Okay. Now, there's something called stereogenesis, which means I want you to close your eyes, and I'm going to hand you something, and I want you to see if you can tell me what it is.
It's a key.
Okay. All right, you can give me the key back. Now let me see your other hand. Okay, what is that?
Coin.
Yes, it is. Okay, so your central stereogenesis is intact. You can open your eyes. Okay, now I'm going to need you to stand up for the next couple things. All right, you can take your cane if you need to, but I need you to walk a little bit, maybe about 10 feet or so. Okay, you can turn around and come back. Okay, now the next thing you'll need to be standing for as well. This is called the Romberg test. So I want you to put your feet all the way together, close your eyes, and hold your arms out to your side a little bit. Okay. All right, you can sit back down. All right. Now, I'm going to check one more thing with your senses. You just stretch your arm out as far as you can, and then close your eyes and touch your nose with that hand. Okay, now try the other one. You don't have to stretch it all the way. Okay. Now, I'm gonna have to check your cranial nerves as well. There's 12 of them. Is that all right with you?
Yes, ma'am.
Okay, now the first one is the nerve that helps your sense of smell. Do you have any problems with smelling anything?
That's the only thing on my body that does work.
Okay. We don't routinely test that nerve unless we have a reason to, so we'll skip that one. Now your optic nerve. We tested that with you doing this. Did you mean to touch the tip of your nose?
No, I just aiming for my nose.
Okay. Now your oculomotor nerve is just how your eyes move. Okay, so I know we did it earlier, but I'm going to check again. Just follow my finger, okay? And you're doing good because both eyes should move the same way together. Okay. Your trochlear nerve, you following my finger, test that one, and the abducens nerve. Okay. Now, one more thing. The trigeminal nerve is mainly linked to your face. So, can you chew? Do you have any problems eating any types of food?
Just nuts.
You'll close your eyes for me. Now tell me if you can feel this, okay?
Yes. Yes. Yes.
Okay. Now, the seventh nerve is your facial nerve. And where it's got two components, sensation, you felt that, and the motor part. Can you smile? Frown? Okay. And since that's symmetric, both of you are working pretty good. The acoustic nerve, we tested that when we did the whisper voice test. But I'm going to do it again, okay? I'm going to stand behind you and whisper something. And if you hear it, repeat after me, okay?
Okay.
Do you hear anything?
No.
Hear anything?
No, ma'am.
Now, normally I would test with a tuning fork, but I don't have one. We'll skip that. The glossopharyngeal nerve, the vagus nerve, is 9 and 10. So what I'm going to have you do is I'm just going to ask you to swallow. Another part of this is eliciting the gag reflex, but since you said that bothers you, I'm gonna do it. All right, the spinal accessory nerve. What I'm gonna do is I'm gonna put my hands on your shoulders, and I want you to try to shrug. Okay, now, try to tilt your head that way. Now this way. Okay. And the last one is your hypoglossal nerve, which is not to your tongue. You stick your tongue out, and then touch it to the roof of your mouth. Okay. That's everything. Yay. Thank you for letting me work with you today.
Thank you.
I appreciate it.
Thank you, ma'am, for giving me a good exam.
Do you have any questions for me
Well, I'll leave.
for another day?
Yay.
Okay.
Thank you, ma'am.